Overview of the Pharmacy Technician Exam. The purpose of the exam for certification of pharmacy technicians, (XCPT), is to evaluate a candidate's knowledge and skills associated with the performance of tasks required for professional practice as a pharmacy technician. This certification provides a means for recognizing pharmacy technicians who continue to demonstrate their qualifications by complying with ICPT requirements and adhering to high professional standards. The role of the pharmacy technician is critical, and it may vary by practice sites. Many states are now regulating this practice through state pharmacy practice acts, which will define the necessary competencies and tasks of the pharmacy technician. Dignity College of Healthcare help our students review and prepare for the EXCPT, which is the National Certification Examination. Examination content. The content of the examination, as shown below, was determined through a job task analysis, during which pharmacists and technicians throughout the country, and from all practice settings, identified the minimum necessary competencies for certification. Examination items fall into three general content categories: 1. Regulations and technician duties, (25%), 2. Drugs and drug therapy, (23%), and 3. The dispensing process, (52%). 1. Regulations and technician duties, 25% of examination. 1.1 Overview of technician duties and general information. 1.1.1 The role of pharmacists and pharmacy technicians. 1.1.2 Functions that a technician may and may not perform. 1.1.3 Prescription department layout and workflow. 1.1.4 Pharmacy security. 1.1.5 Inventory control. 1.1.6 Stocking medications. 1.1.7 Identifying expired products. 1.2 Controlled substances. 1.2.1 Difference among the controlled substances schedules. 1.2.2 Refills, partial refills, filing, and prescription transfers. 1.2.3 Correct procedures for handling Schedule B sales. 1.2.4 Controlled Substance Act. 1.2.5 DEA numbers. 1.3 Other laws and regulations. 1.3.1 Federal Privacy Act. 1.3.2 Generic substitution, including brand versus generic products. 1.3.3 Professionals with prescribing authority, and acronyms. Introduction. 1.3.4 Child-resistant packaging. 1.3.5 Role of government agencies, Board of Pharmacy, DEA, FDA, etc. 1.3.6 Manufacturer drug package labeling. 1.3.7 Over-the-counter, OTC, package labeling. 2. Drugs and drug therapy, 23% of examination. 2.1 Drug classification. 2.1.1 Major drug classes, for example, analgesics, anesthetics, antibiotics, etc. 2.1.2 Dosage forms, types, characteristics and uses. 2.1.3 OTC products. 2.1.4 NDC number. 2.2 Most frequently prescribed medications. 2.2.1 Brand and generic names. 2.2.2 Basic mechanism of action, pharmacology, and drug classification. 2.2.3 Primary indications. 2.2.4 Common adverse drug reactions, interactions, and contraindications. 3. Dispensing process, 52% of examination. 3.1 Prescription information. 3.1.1 Information required on a valid prescription form. 3.1.2 Telephoned and faxed prescriptions. 3.1.3 Refill requirements. 3.1.4 Patient information, age, gender, etc. 3.1.5 Interpreting prescribers' directions for prescription labels. 3.1.6 Recognizing and using common prescription abbreviations. 3.2 Preparing/dispensing prescriptions. 3.2.1 Avoiding errors, such as sound-alike/look-alike names. 3.2.2 Systems for checking prescriptions. 3.2.3 Automated dispensing systems, including quality control. 3.2.4 Procedures for preparing prescriptions and data entry. 3.2.5 Labeling prescriptions properly. 3.2.6 The purpose and use of patient records. 3.2.7 Proper packaging and storage. 3.2.8 Managed care prescriptions. 3.3 Calculations. 3.3.1 Conversions/systems of measurement used in pharmacy. 3.3.2 Calculating the amounts of prescription ingredients. 3.3.3 Calculating quantity or days supply to be dispensed. 3.3.4 Calculating individual and daily doses. Introduction. 3.3.5 Calculations used in compounding. 3.3.6 Calculating dosages and administration rates for IVs. 3.3.7 Business calculations, pricing, markup, inventory control. 3.4 Sterile products, unit dose, and repackaging. 3.4.1 Drug distribution systems used in hospitals and nursing homes. 3.4.2 Procedures for repackaging medications. 3.4.3 Prescription compliance aids. 3.4.4 Aseptic technique and the use of laminar flow hoods. 3.4.5 Special procedures for chemotherapy. 3.4.6 Routes of administration for parenteral products. 3.4.7 Types of sterile products. 3.4.8 Correct procedures for maintaining a sterile product environment. 3.4.9 Accurate compounding and labeling of sterile product prescriptions. In summary, adequate preparation for the EXCPT is important. When done, student can pass at first try. Thanks again for enrolling into Dignity College of Healthcare.